Sis P. Hello. Ma'am Kale. Ma'am Kale.
Recording in progress.
Good morning, honorable members. It is now exactly 10 o'clock. I think it's time to start our meeting. I want to welcome all members to our meeting, all our support staff, our department, our guests. Ms. Nobotana, can you please flag the agenda for us and then also just tell us who's in the meeting and also just table the apologies if there are any.
We'll do that. Thank you, Chairperson. Give me a second. Good morning, Chairperson. Good morning, members. Support staff, Ms. Ndwandwe, and officials from the department. I have flighted the agenda. I've received an apology, Chairperson, from the Minister and the Deputy Minister and DG who have attended a cabinet committee meeting today, Chair. And I'm told that the DG might join the meeting at 10 when she's done presenting the cabinet memo.
Okay.
And Mr. Machoba will be presenting on behalf of the department. Thank you, Chairperson. Members who are here, we have about 8 members. Is Honorable Kaule, Spies, yourself, Chairperson, Honorable Adams, Shabangu, Peterson, Dr. Ditlape, Ms. Kanyile. Thank you, Chairperson.
Thank you very much, Ms. Nobatana. Can I just ask that the department also just introduce their delegation? So I understand that there are the apologies for the Minister, Deputy Minister, and also the DG. I'm really hoping that the DG can at least join us, even if it's late, because we are dealing with a very important topic this morning, something that is very close to this committee's heart. So I do hope that there is a sufficient delegation from our department present. So let me just maybe ask that the department representatives introduce themselves as well, please.
Good morning, Chairperson. Oh, sorry, I think
No, go ahead, please.
Thank you, Chairperson. I was a bit hesitant because I was trying to figure out who else is here, more senior to myself. But my name is Sipho Machoba from the Department of Women, Youth and Persons with Disabilities. I am the Acting Chief Director, Social Empowerment of Women, and I'm basically managing the Sanitary Dignity Program. I'm the program manager for that, ma'am. Thank you.
Thank you very much, Mr. Machoba. I also heard another voice. I think it's Ms. Mpondo.
Good morning, Chair. Good morning, members. My name is Thandiwe Mpondo, the Parliamentary Liaison Officer of the Ministry. I'm with another colleague who will introduce himself.
Good morning, Chair. Good morning, colleagues, and good morning, members of the committee. My name is Puso Khoza, in the Deputy Minister's Office in the Ministry of Women, Youth and Persons with Disabilities. Thank you.
Thank you very much to our colleagues in the department. Is that everyone for now? I think. Okay. Good morning.
It's Bonnie here, Makaleni from the Office of the DG Department. Thank you.
Thank you so much. Honourable members, this morning, I think, as I've stated before, we are dealing with a petition, and I think the petitioner is in the meeting already, Ms. Ndwandwe. She will introduce herself. I think from the outset as a committee, we really value the fact that she has approached us to make this petition before the committee this morning. This petition is really something, I think, like I've said, that it's a project, a framework, the Sanitary Dignity Framework, that is something that is very close to this committee's heart. And Ms. Ndwandwe, I think I will hand over to you that you introduce your petition and then also take us through your presentation this morning. Thereafter, I will ask the department to also make their presentation before I hand over to members for their inputs and questions. Ms. Ndwandwe.
Good morning, everyone. Thank you so much, Honorable Lizo van der Merwe. My name is Nogzola Ndwandwe. I'm a menstrual health rights activist. I'm the founder of Team Free Sanitary Pads, a movement which strongly believes in the eradication of period poverty, which also strongly believes in the empowerment of women and young girls, particularly in rural communities, particularly in overlooked communities, in remote communities across the country. We've worked with global organizations such as the UN, the Global Citizen. We've worked with the UNFPA. We've also worked with the Department of Women, Youth and Persons with Disabilities as well. I recall that we submitted the petition, I think, a few years back. We had our deliberations and discussions, and we spoke about ways in which to improve menstrual health and ways in which to recognize menstrual health as a human rights issue in the country. And so my fight for menstrual health and hygiene management stems from my own personal experiences. When I was doing VAC work for a particular organization, I woke up in the morning and I experienced severe period pains. It wasn't the first time experiencing severe period pains. For a very long time, I thought that severe period pains were actually normal due to lack of education around menstrual health and hygiene management. But much to my surprise, in 2014, I was rushed to the hospital. The menstrual pains were too severe to the point that I couldn't function, I couldn't work, and I couldn't perform to my normal ability. So my male-dominated team had to stop working and they had to rush me to a hospital because we were in an industrial area whereby the ambulance doesn't really reach that point in a very fast pace. We're on the south side of Durban. So my male-dominated colleagues had to rush me to the hospital. And when I got to the hospital, the doctor did a few scans and the doctor suspected that I have endometriosis. And it was true that I have endometriosis. Endometriosis is a painful condition whereby endometrial tissue, which is supposed to be within your uterus, grows outside your uterus, which affects your ability to function. It has an impact on the fact that you could develop allergies or anaphylactic shock, which is something that I currently have now. It has a very negative impact on a female body or a young developing woman. And so when I came back to the office the next morning, my condition became of interest to my male-dominated team. At that time, I felt a sense of shame being on my period and being exposed in that manner around my male-dominated team. And so that's when I thought it was time to deconstruct the narrative and end period stigma, but also create about education around menstrual health and hygiene management, whether in schools, in the workplace, or in public spaces. But also, I realized that in the country, there was a need for the provision of free menstrual products for all women, I would say, because period poverty does not discriminate, whether you're working or at school, or even in a public space, or even unemployed, you'll be impacted by period poverty. And so that's when I started working with international organizations. I also approached members of parliament. I also recall working with Liesel van der Merwe as well, calling for the VAT scrap on menstrual products. It was so fortunate that before our late Minister of Finance, Tito Mboweni, before he went back into office and becoming a Minister of Finance, we had a few interactions prior to him becoming a Minister of Finance again, serving for his probably continuous term. And so I had a discussion with the minister about the fact that we have an issue and a crisis on our hands in the country, whereby young girls are missing out on school. Young girls do not have access to clean toilets. Young girls do not have access to clean environments in order to, experience their period. So they also do not have the education around menstrual health and hygiene management, which means that their menstrual health cycles are mismanaged and they make misinformed decisions, or rather they make use of material rags, toilet paper, which is something that is not hygienic, nor is it healthy for a young girl to use toilet paper, which is not specifically or standardized for purposes of menstrual health and hygiene management. But it didn't stop there. I worked with the international organizations. We formulated petitions. We wrote to members of parliament. We pulled in the private sector in terms of eradicating VAT on sanitary products. We were also shocked that the VAT scrap was only applied to sanitary pads. We wanted the VAT scrap to apply to all menstrual products. The purpose of the VAT scrap was for purposes of ensuring that the government, various departments, the public recognizes menstrual products as a basic, necessary, essential. And so, which is why we continue to petition, and we have a petition today around calling for the South African government to recognize menstrual health and hygiene management as a human rights issue, but also to have a bill and a law at hand so that the fight for menstrual health rights becomes a sustainable fight, and it becomes a matter of the fact that this is a human rights issue. It's a norm. It's not something that women and young girls should be ashamed of the fact that they're experiencing a natural biological process. And so we are here fighting for the menstrual health rights bill and law. And part of the work that we do as Team Free Sanitary Pads is that we do menstrual health rights workshops across the country. We also fight for policy and advocacy. We also try our best to work with various departments, like the Department of Women, with the a coalition on menstrual health and hygiene management. Even though we have the sanitary dignity policy framework, we feel like perhaps we can expand the scope. We could have a bill, a law, which actually has teeth, which actually holds individuals accountable, whether in society, whether in government, or you are a member of parliament. However, as we process or continue with the distributing menstrual products, continue with the education, we need to ensure that the information that is distributed is actually information that is accurate, information whereby various departments, even the private sector, collects data around menstrual health and hygiene management to actually ascertain as to see where are we in terms of eradicating period poverty in the country. Are the current processes in place effective? Is it enough to distribute 4 menstrual packs when we experience periods or our menstrual cycles as individuals differently? Because different women have different flows in terms of when experiencing that menstrual cycle. So one individual may not be satisfied with the government providing maybe 1 pack or 4 packs of menstrual products. Also, period product choice. One individual or one menstruator may not be comfortable with using a sanitary pad, perhaps maybe because they have some form of allergies or reactions around that particular period product. Or another menstruator may not be comfortable with using the menstrual cups, probably because of the stigmas associated, which is why we need to enforce the education around menstrual health and hygiene management. And so we're also calling for the South African government to ensure that there's menstrual health and hygiene management education in schools. And particularly, I think, to emphasize the point that we need to have access to free menstrual products on a consistent basis. And the distribution of these menstrual products needs to be monitored. There needs to be oversight as to ensuring that the menstrual products are actually going to, to the beneficiaries, or also to ensure that the menstrual products are not resold in the black market and they're not actually serving the particular purpose, which is to ensure that young girls and women have access to menstrual products so they can have access to career advancement opportunities, so they can have access to quality education. And also the monitoring, maybe perhaps the auditing, or maybe perhaps develop or create a database in terms of the various schools in the country and monitor the schools across the country and also the workplaces and the public spaces, and to expand on the budget on free menstrual products. I know the initial budget was 157 million, but as our ongoing discussions and working with the Department of Women, Youth and Persons with Disabilities, we also found out that they expanded on the budget. However, we feel like it's not enough to just say that, well, the budget will be limited to a particular group of people, when in fact period poverty does not discriminate. All women and young girls deserve to have access to quality menstrual products. And another concern would be the quality of the period products. I know that from our personal experience, having used one of the brands from the multinational organizations, I mean, we trust a multinational for some strange reason. I wouldn't encourage this based on my experience, is that we experience allergies to the menstrual products. Some of the menstrual products cause UTIs. Some of the menstrual products are so detrimental to the fact that they trigger menstrual health related illnesses like your endometriosis, like your cervical cancer and fibroids. And so I feel like we also need to investigate the products in the market. Are the products organic? Are the products really made from cotton? Because some of these multinational organizations will market the products as to say that these products are free from particular toxins and these products are 100% cotton, when in actual reality, the products are made from plastic and reused materials, particularly the disposable products. And these materials are actually not very good for women's health. And so we also need to take into consideration that if we have a legislation in place, if we have a law in place, we can hold everyone in society accountable for essentially women's health. We need to also prioritize the fact that menstruation does not only, impact the fact that there's free menstrual products or there is, you're controlling that time of the month. Menstrual health has an overall impact on the biological conditioning of the woman. So if, let's say, you are 18 years old and you are mismanaging your period at the age of 18 due to lack of access to the quality menstrual products, due to lack of access to quality education around how to control or maintain your period, then it's going to have some form of effect when you either reach the age of 20, the age of 30, and it continues because your vagina is a breathing organism and it absorbs all the chemicals or all the materials that you actually use during that time of the month. And the fact that we menstruate almost every month has some form of an impact in terms of women's health. And so I feel like we have to also pay close attention as to the quality of menstrual products in the market. Another issue will be gender equality, empowerment in terms of the period products organizations, the local organizations that are being developed. We want to manufacture menstrual products in the country. I mean, if we have a manufacturing plant for condoms, why can't we have a quality menstrual plant for menstrual products for young girls and women? Because as much as it's controversial to say this, menstruation is not a choice. It's a natural biological process whereby you cannot control it. It impacts you regardless of your socioeconomic standing. You can be in the rural areas and not have access to a clean toilet or water or quality sanitation, and your natural biological process, when it's time for it to clock, it will clock and you'll go through that period. And so if we do not make some form of provisions as the government or as members of parliament or as lawmakers, then I feel like we are failing the women in our country. We're failing the young girls in the country to access quality education, to access career advancement opportunities. Who knows? Perhaps we should also do an investigation as to how come in the country we have a dire issue of unemployment. It could be that young girls, making the majority of the population, could be impacted by issues around women's health. So we need that legislation. We need a bill to ensure that there's accountability, to ensure that everything is implemented in accordance to the fact that young girls and women have a right to, to access their dignity. They have a right to quality of life as per the Constitution and the Bill of Rights. Also, the issue around the SABS certification. I know I partner with an organization whereby we created our own brand of menstrual products. This was from April in 2023 last year. And we ensured that in terms of the quality of the menstrual products, that we meet the SAPRA standards, which is the health regulatory standards, and we meet the SABS standards. How many menstrual products in the country do not meet the specifications and are actually being sold in the black market, are actually being sold in spaza shops, are actually being sold just, probably on the streets? And these menstrual products, as much as they're cheap and they're affordable, but these menstrual products could be of detriment to the health of young girls and women. And so we need a legislation to ensure that there is oversight, not only in government or in parliament, but also on the ground at grassroots level. We need to ensure that our girls are educated, that our boys are educated around menstrual health and hygiene management, particularly the products. Also around the fact that how do you ensure that your sister at home or your mother at home does not suffer from some form of menstrual health related illnesses, which is why we need leave policies as well in the workplace, but also as governments, perhaps you should start implementing policies in the workplace that actually cater and accommodate for the needs of young girls and women who experience menstrual health related illnesses like endometriosis, like fibroids. The severe pain that comes from these menstrual health related illnesses means that you cannot function at all. It means that you become bedridden, that you have to stay in bed for as long as the pain has, has settled down, and that you have access to the correct medication, which could be very expensive for someone who's unemployed and who's residing in a rural community and who cannot access or afford medical care. And so that is our call. And also that various departments work together with the activists, with scholars, more research, funding towards research around women's health and around, quality menstrual products being distributed across the country and in the market. and hold multinationals accountable, as well as local small, medium enterprises accountable for the types of products that they're distributing in the market. And that's about it. Thank you so much. And so our call is that we cannot continue to allow the lack of access to dignity to keep our girls out of school and for women to miss out on career advancement opportunities. Young girls and women and all menstruators in South Africa need the Menstrual Health Rights Bill and Law now more than ever. If London can do it, if the UK can do it, and other countries can do it, so can South Africa. The same way we make provision for free condoms is the same way we can make provision for free menstrual products through a Menstrual Health Rights Bill and Law. I thank you.
Thank you very much, Ms. Ndwandwe. Thank you very much for that presentation. And I think just at the outset, we really do thank you for all the work you are doing in the service of our nation, and in particular around the empowerment of young women. And I think as a committee, we share your sentiments that it is time to end period poverty. We have noted your proposals. I think what we as a committee will have to do is to see whether we think that additional legislation would be the vehicle through which we achieve this, or whether it is to take on board some of the proposals that you've made, such as extending VAT not only to pads, but to all menstrual products. For example, expanding the scope and reach of the current framework that is in place. We as a committee have to ask ourselves whether it's effective, whether it's reaching all the intended beneficiaries. But those are some of the questions that we will be engaging on as we proceed. I want to now hand over to the department to make their presentation, and thereafter we will go to honourable members to ask questions and make their inputs. The department.
Thank you so much, Chairperson and honourable members, and also greetings to Ms. Ndwandwe. If I may ask Ms. Nobatane to please flight for me the presentation.
Nelly, are you winning?
Just give me 2 minutes. But I thought he was going to flight it. I've given him the sharing right. So
Honourable members, while we are waiting, my apologies. I forgot to ask in the beginning if honourable members are happy with the agenda that was tabled. I'm sorry, we are now already far past the agenda, but I hope that members were happy with the agenda that was tabled and that we... Okay, Honourable Shamango, I see your hands up. My apologies for that, honourable members.
Thank you, Chair, and good morning to the members on the platform. Just to do it officially, yes, the proposal, the adoption of the agenda. Thank you.
Thank you so much, Honourable Shabango. I see the hand of the Honourable Adams.
Thank you, Chair, and good morning. I second on the movement of the agenda. I thank you. Adoption of the agenda.
Thank you so much, colleagues, and my apologies for that. Over to you. I see the presentation is now flighted. Can we get the department to speak to the presentation, please?
Thank you so much, Chairperson. Our presentation is in 2 segments. One, just to give a snippet update on the Sanitary Dignity Program itself. And then the last segment will speak to the issue of policy versus legislation. What is the view of the department on that matter? If I may then proceed, ma'am, to the first slide.
Please proceed.
Yes, ma'am. The purpose of the Sanitary Dignity Implementation Framework is to ensure that girls and women are assisted by government to address period poverty. And the strategic objectives are to ensure that women and girls manage their menstruation in a knowledgeable, safe, and dignified manner. For indigent girls in quintiles 1, 2, and 3 schools, which are no fee-paying schools, together with special schools as well as farm schools, this is to ensure that there is uninterrupted learning so that girl learners can be able to reach their fullest potential, just like boys, so that they are not inhibited by the natural process of menstruation. Another important aspect of the program, Chairperson, apart from just addressing period poverty, is to ensure that through the public procurement process, women, youth, and persons with disabilities owned and run enterprises benefit from this program, from manufacturing, distribution, storage, and safe collection and disposal of used sanitary pads. Our rationale is that if menstruators are women, they are the best to know which are the best products to use in terms of comfort, look and feel, absorption, and even issues of disposal and proximity to water. Hence, we are saying that, therefore, if there is to be any economic benefit, therefore, those women-owned and run enterprises should be foremost in terms of government procurement process. And also, this is to lessen over-dependence on multinational companies that are currently making a lot of money from the menstrual health industry. Also, as Ms. Ndwandwe has indicated that, one, there is a financial mandate for this program since 2019-20 financial year. In other words, there is a budget, which I will speak to as I go along with the presentation. And also to indicate that there is a zero VAT rate on disposable sanitary pads from April 2019 up until the present moment. You might recall, Chairperson and members, that they have been petitioning. There's normally a petitioning that goes to National Treasury, wherein it is finally decided which products, which food products or products in general should be zero VAT rated. And amongst that, it has been the disposable sanitary pads. There were submissions from civil society and even from our department. There was a submission to National Treasury to make sure that the disposables are zero VAT rated. So I could say that it has been a collective victory from both government and civil society that we have this zero VAT rate. But let me also hasten to explain that the reason why initially the zero VAT rate was on disposable sanitary pads is because when the program started, we are actually even now distributing disposables because from a product safety perspective, they were the only products that had a South African Bureau on Standard certification. In other words, the products that we distribute as government, in order to ensure that there is no litigation, we protect government, we only distribute products that are SABS approved in terms of product safety. So at that time, none of the products were SABS approved, like your menstrual cups, tampons, rewashables, and reusables. Although the situation has changed now, hence we are also exploring now the issue of product mix, product choice, but within product safety perspective. A typical example is that in 2021, the reusable and rewashable sanitary towel also received an SABS standard. And we are currently doing what we call acceptability studies. We are running a pilot in KZN in Uthugela district and in Eastern Cape in Alfred Nzo. We have already handed out some of those reusables and washables so that learners then can give us feedback, Chairperson, in terms of how comfortable they are with those products. And by the end of the financial year, we'll be having a close-up report in as far as that, so that we're able to say this is the level of acceptance in as far as these alternative products are concerned, which also includes, obviously, access to water, because these are rewashables. and some of the schools will be in rural villages. And then secondly, another development, Chair, has been that last year in October, the menstrual cup has also received an SABS standard, which means that also gradually it will come to the fore as well. And for the tampon, there is still a process of comments out there in the public, which SABS is managing. So all in all, therefore, Chairperson and colleagues, we are saying that our policy dictates that there should be a product mix, there should be product choice, but within the ambit of product safety through the SABS as our quality assurance body. But let me also hasten to say here, because it is important, Chairperson, that if you go to retail, whether you go to Clicks or Discam or Boxer or Pick n Pay and you purchase menstrual products, some of them are not SABS approved. The reason for that is because the SABC, or rather the SABS issue is not mandatory, it's voluntary. Therefore, at this stage, it is not enforceable throughout, as much as government is indicating that any menstrual product that is rolled out or distributed by government will have to have SABS approval. But if you go to retail, that is not necessarily the case because it's not mandatory. So what we have done, we have corresponded with the national regulator on compulsory specifications to ask whether can they move towards ensuring that for all menstrual products in the country, the SABS standard is mandatory, and we're still awaiting for a response in as far as that is concerned, because that is the decision of the national regulator on compulsory specifications. And then the next slide. Before we go to this one on the equitable share, one before that, please, the second slide. Thank you so much. Yes. This is just an illustration, Chairperson and honorable members, that in terms of how this program is implemented in provinces, when we got the equitable share allocation from National Treasury in 2019-20 financial year, a question arose at the Technical Committee on Finance, which department should actually roll out this program at provincial level. For some of us, we thought naturally it would be the departments of education because schools are located within the ambit of the departments of education. But then after some discussions with provinces, it was felt that in terms of the institutional arrangements of some provinces, this basket of services are better done within the ambit of social development. And then there was an agreement, therefore, that based on what the choice of a particular province is, a province will decide whether it shall roll out this program through social development in the provinces or departments of education in the provinces. In other words, what would happen is that the equitable share allocation would be dispersed by National Treasury to provincial treasuries, and then from provincial treasuries to the implementing departments, be it the Department of Education or the Department of Social Development. So that is currently the arrangement. Next slide, please. This, Chairperson and colleagues, is the equitable share allocation for provinces. And note that it's not an equal allocation, it's an equitable allocation based on the size or the geography of the province, the population density and other considerations that might have been made by National Treasury. So when we went to National Treasury at the beginning, in order to reach all the quintiles, 1, 2, 3 special schools as well as farm schools, we had asked for a budget of 400 million from National Treasury at that stage in 2019. But what Cabinet said and subsequently National Treasury was that this program must take an incremental approach because of budgetary constraints. In other words, we could not get the 400 million as we had wished. Hence, in 2019-20, the budget was 157 million, far short of the 400 million. But true to the promise of National Treasury and Cabinet, there has been an incremental input into the budget itself. Hence, if you see on the red allocations, now it's 246 million from that 157 in 2019. And in the next financial year is 257 million. The other financial year, 266 million. So there is a gradual increment, but obviously it is not what it ought to be in terms of our aspirations. And then in terms of the allocation itself, just quickly, Chair, to say that the province that is the highest allocation is KZN at 57 million, followed by Eastern Cape at 44 million, and then the least would be Northern Cape at 5 billion. May I also just hasten to say that with KZN, apart from the 57 million that they have also creatively added their own 30 million from their own Department of Education budget to complement the 57 million, which we thought that it was a remarkable thing to do on their part. And also coming to Gauteng, apart from the 30 million that we see there from Gauteng, they also have a whopping 130 million that they have added to the budget, because in terms of their approach to this, they distribute what is called dignity packs, not just sanitary pads, which include lotion, lip balm, and hats for learners with albinism, also school uniform, then the rest, boys and girls, deodorants, toothpaste, soap, washing towels. So there's a larger basket of services that Gauteng is able to provide. Hence, there's that additional 130 million from the Gauteng Department of Social Development. Next slide, please. Now, Chairperson and colleagues, to also show how expansive this program is, because at times we tend to only concentrate on the equitable share allocation to the schools that I've mentioned. Government also, broadly, other sister departments play a role in mitigating period poverty. Long before even the Sanitary Dignity Implementation Framework came into fruition, these programs have always been there, but it has always been that perhaps there's been a bit of fragmentation and these developments have not been recorded in a meticulous manner. A typical example from all NFSAS beneficiaries, all those who hold those bursaries from NSFAS, they receive stipends, monthly stipends of 290 per month to buy toiletries and menstrual products. Apart therefore from just the bursary for tuition and accommodation, there's this 290 per month that is given to learners. And for female students, that is about 450,000 female students that are NFSAS beneficiaries currently that receive that benefit, which we think that is quite an important input into mitigating period poverty. And secondly, through the Department of Correctional Services, all women inmates serving and remanded receive free sanitary pads. And the number, but of course it could fluctuate, it was about 3,900 inmates. And from the Department of Social Development, also free sanitary towels are provided to women and girls in places of care, places of safety, child-headed households. That's a category through the social relief of distress consignments. And also from the Department of Health, women and girls in psychiatric and maternity wards receive free sanitary pads. And then we can move. So that just shows the expansive nature of the program of government, not just simply limited to the schools. And then now coming to the benefits of the program. Since 2019, Chairperson and honorable members, indeed learners in those quintals, special and farm schools, have been beneficiaries of the program, which is very, very important that on a quarterly basis, there is a rollout of these products to learners in the schools. And as I've indicated, that all these pads that are delivered to school are SABS compliant. And also to indicate that apart from distributing products to learners at school, the department and partners are engaged in advocacy and information sessions on menstrual health, sexual and reproductive health rights issues, water supply, sanitation and hygiene issues. In fact, we do what we call wash assessments in schools. We always go quarterly to provinces to view wash facilities, whether they are compatible with girls that menstruate, because we need toilet facilities that are menstruator friendly or girl friendly. Part of that example is that there should be lockable toilet cubicles for safety and dignity. There should be water and soap for washing after changing a pad. There should be disposal bins. In some instances, there should even be a mirror so that when the girl comes out of the toilet cubicle, there is some confidence built in, you know. So those mirrors also play a critical part. Also to indicate, Chairperson, that menstruation is not addressed separately from teenage pregnancies, because once a girl child reaches menarche, possibilities of unplanned and unwanted pregnancies may arise. So in our advocacy, that therefore menstruation or menstrual health is basically advocated together with the issues around prevention of teenage or adolescent pregnancies. Also, what we have realized is that over time, there's been a degree of awareness from male teachers, in particular, life orientation teachers, school governing bodies, boy learners as well, about the centrality as well as the importance of menstrual health as well as and sexual and reproductive health. From my screen, Chairperson, the presentation is gone. I don't know whether you also experience the same thing.
Yes, it's no longer being flighted. Ms. Nobatana, can you just try and put the presentation up again for us, please? Nelly? Ms. Abrams, can you try and assist?
Good morning, Chairperson and members. I'll just check to see whether Nelisa has given me hosting rights. The Simpiwo, I've just checked now, Chair. He does actually have hosting rights. So he could flight the presentation from his side. Nelisa has enabled him to share his screen.
Okay.
I have a very antiquated instrument here, honorable members. Please excuse me. It just cannot do that. It's an old laptop. So that's the difficulty that I have. I'm so sorry.
Okay, well, I think also, and then we'll have to have a discussion with the department at some point with regards to your tools of trade, because it's important that you are able to fully participate in these meetings. I think, okay, Nelly says, Ms. Nobatana says she has lost connection and she will now rejoin. I think that is why she's unable to flight the document. We will therefore have to wait for her to come back into the meeting. Let's just, in the meanwhile, Ms. Abrams, do you have sharing rights? No.
No, Chair. Perhaps we could check with Mvaba if he's got sharing rights, then he could, because Nelisa would have to come on as the host to be able to give me the shares again. Maybe Mvaba has sharing rights.
Is Mvaba in the meeting?
Chair, in the meanwhile, would it be a big problem if I proceed and then when Nelly gets back on the screen, then we are able to rejoin, at least from a visual point, or maybe
Yes,
that.
I think members, I think let us just give, I think all members of, oh, there we go.
Oh,
That's fine.
there we are.
All members have seen the presentation, so I would have said it's no problem for you to proceed. So let's continue, please. Thank you. Nelly, I think you just need to scroll down. Yes.
Yes, that's where we were. Thank you, Chair. I'm going towards the end now in terms of the presentation. Also, just to indicate, Chair, that one of the benefits has been that women and youth-owned enterprises have benefited from this program in terms of, in particular, manufacturing and distribution. We are aware that the scene has been dominated largely by multinational companies, but the situation is turning around rather slowly. But there are women-owned and run SMMEs at this stage. The typical example is that one of the biggest achievements in Gauteng has been Lindiwe Pets, which is based in Midrand, which is South African, women-owned. That is something that that is commendable, and they've been assisted by DTIC, IDC, and of course, there were motivations from ourselves as DWIPD. We're hoping that this will obviously extend also to other aspirant manufacturers in particular. And also, there is one called Dear Bella, women run and owned. In KZN, there's a youth-owned enterprise in Verulam, Access Medical. There's also a TVET college in Hammersdale next to Pietermaritzburg, which is also a manufacturer. In Cape Town, or in the Western Cape, there is Lion Match. Those are South African owned local manufacturing entities, but as indicated that there are still a lot of initiatives between ourselves, Department of Small Business Development, as well as DTIC, to draw as many women to ensure that they get into the manufacturing aspect of these enterprises. Currently, most beneficiaries are distributors more than manufacturers. And there, I could safely say there is quite a huge number across the provinces of women, youth-owned distributing agencies. But at this stage, our challenge is that distributors or manufacturers or generally entrepreneurs with disabilities are not in the scene as yet. That is one of the challenges that we are still working on with our partners. And then coming to the challenges, Chairperson, quickly to say that the biggest problem is not so much as a DWIPD challenge per se, because from the point of view of DWIPD, we have developed a policy framework, monitoring and evaluation framework. We have ensured that there is an equitable share allocation to provinces, but the biggest elephant in the room, Chairperson, and this is where the portfolio committee can assist us, but at least the Honorable Van der Merwe is well aware of this as the veteran of the portfolio committee. There is a chronic problem of delayed procurement processes in provinces. I will speak to that later. And also, as a result of the above, then the budget is not optimally spent. We have always insisted that in order to see the gaps, how many learners were not reaching and costing those gaps and going to National Treasury with evidence-based information, we need to ensure that all provinces spend every rand and cent. That is very, very important. And that is not necessarily happening. A classical example is that since 21-22 financial year, the Free State province has not delivered a single pet in that province. there are delayed procurement processes, there are cancellations of procurement processes, there are things that are unexplainable that are happening there. At some point in Limpopo, there was also litigation that stalled the program because of problems at procurement process, but the issue now has actually been resolved. Also in Gauteng, regrettable, there have been those problems of late of delayed procurement processes. So I could surely indicate that had it not been for the delay in procurement processes, this program would have been absolutely impactful, Chairperson. So there's a big discussion point that is required on provinces or provincial efficiency or issues around provincial procurement processes. Also to indicate that what we are doing now is we are also conducting a money flow and gap analysis, and we are going to province by province to see how we can ensure that we are able to identify where the shortcomings are. And also one of the challenges is that at times we do not really receive credible evidence-based information from provinces from a reporting perspective. Provinces have to report to us on a quarterly basis, but sometimes when it comes to verification and evidence, the portfolio of evidence that we need, sometimes we don't get it. Also, there are human resource challenges in provinces. And the last issue is that from an institutional level, provinces don't have what we had advised them to establish provincial sanitary dignity committees, so that becomes a committee that is able to monitor every aspect of the flow in as far as the pad reaching the learner at the right time, in the right quality and quantity. So those are some of the challenges. And then those challenges that are narrated in terms of each province, Chair, which I think maybe we may pass and that honorable members have gone through, but they merely just indicate what the specific issue is within a particular program. And then way forward, before we go to the policy and legislation issue, the department, Chair, and honorable members, is exploring the possibility of a transversal procurement process. The transversal procurement process is managed at National Treasury, but it is not necessarily a national procurement contract as such, because at specification and evaluation stages, provinces are represented. But what is important about it is that at least you take away that ability from provinces because of the delayed processes. It is managed by National Treasury, but they are not excluded. When it is managed by National Treasury, it ensures that there is timers planning as well as execution, and then we also, together with National Treasury, will do monitoring and evaluation. That will also ensure that there is standardization, especially on issues like pricing, price per pet, instead of different pricing from different provinces, etc. So for standardization, as well as from an efficiency level and also from a service delivery level, we think that perhaps a transversal procurement process managed by National Treasury might also be an important issue. I've already spoken about the cost-benefit analysis that we're developing with provinces, and also the third slide on issues of teenage pregnancies. We are working on a national action plan on teenage pregnancies because we've realized that with all the work that is being done, sometimes very good work that is done on mitigating teenage pregnancies, but the issue is that national departments and provinces are fragmented. And as a result of that fragmentation, the impact is not exactly visible or impactful as such. And also to indicate that we are still going to work further as we are doing on information sessions, advocacy sessions on menstrual health and sexual and reproductive health rights issues. Also, the issue of WASH in schools is a crisis in some schools, in rural schools. the situation is chronic, Chairperson and honorable members. Therefore, we are working closely with the Department of Basic Education on issues of school infrastructure, in particular, toilet infrastructure and supply of water and sanitation. Also, we are conducting monitoring and evaluation workshops in provinces to ensure that there is better planning, execution, and monitoring. And then lastly, now to come to the issue of policy versus legislation, Chairperson, to indicate that this has been debated at length within the department. And also subsequently, the matter was brought to the attention of national and provincial departments, those that are engaged in this space. As a result of that, we had a sanitary dignity consultative indaba on the 13th of July, 2017 in Pretoria. The view that triumphed about the issue of legislation versus policy, Chair, in short, is that there is no fundamental contradiction between policy and legislation, because everything that we want to factor in order to improve on this program can always be done in the amendment of the Sanitary Dignity Implementation Framework. All the issues that Ms. Ndwandwe was alluding to could be factored into the policy framework. The challenges that we have at this stage as a department, speaking on behalf of government, is that when it comes to a legislative process, is that it is obviously mandatory, enforceable, and as it is understood that if that is not done, of course, naturally, civil society organizations and NGOs will go and litigate or go to the Constitutional Court and actually litigate for the enforceability of a particular program. But in this instance, Chairperson, is that as much as we all share the view that all women, in fact, it's a feminist perspective that all women should actually receive free menstrual products. But now, aspiration and context and reality are two different things, because at this stage, like I had indicated, in 2019-20, we had asked for 400 million, which we did not get, and we got only 157 million, and now we're still at 246 million. Now, if you make this legislation at this moment, we think it's premature to move towards a legislative framework, which is not going to be enforceable, which is not going to be really mandatory, because we would not have the funds to be able to even accede to whatever form of enforcement per legislation. That is why even Cabinet itself indicated that it realizes that the situation is not a perfect one, hence the suggestion of an incremental approach. So our plea as government is that at this stage, perhaps we should not at this stage consider a model which we know that we're not going to be able to implement in view of financial constraints. But if we really had adequate funding, there would have been no problem with legislation at all, because the issue would be, if you have all the money, why are you not implementing the program to its fullest? That is rational, that makes a lot of sense. But at this stage, with the kind of budget that we have, where we are able to reach, give or take, about 70% of learners, we are not going to be able to cover for the other 30% until there is a way in which further funding down the line can be found. What else at this stage, Chairperson, as I conclude, we work with partners. It's not just simple government. We work with partners like your Track for Mandela, Old Mutual, Footprints Foundation, Imbumba Foundation, UNFPA, UNICEF, and many others, including Ms. Ndwandwe's organization. In fact, it would be great if we knew the footprints of Ms. Ndwandwe's organization, where they operate, where they distribute, so that if we know that they are in a particular area or space in the country, we know that perhaps we may save by not going there and actually focus on other areas. That is why perhaps besides the presentation, it would be good to actually see the length and breadth of the organization's footprints so that we can work together where government cannot play a role with it. It can then be complemented by organizations like as DISCAM does, as CLICS does, and other organizations that also play a role in mitigating period poverty. Thank you so much, Chairperson and colleagues.
Thank you very much, Mr. Matshoba. Thank you very much for the presentation, and thank you also to Team Free Sanitary Pads for their presentation. I think listening to both presentations, I don't think you are far from each other in terms of both of you have acknowledged that there are shortcomings, and I think your presentation is very clear on that. Mr. Matshoba, I'm not sure whether wanting to achieve sanitary dignity for all is a feminist view or whether it's a human rights view. I just think we need to look at our terminology. Then I also think just a comment that I would like to make. I would have expected if the minister and deputy minister is not in, that at least we would have the DG present. However, I do acknowledge that, of course, we'll have more meetings around the sanitary dignity program and framework in future meetings. But it would have been important for at least the DG to be here. I don't know if she's joined the meeting by now because there was an apology for 10 o'clock. Also, in terms of the presentation, I think I get really worried when you tell me that in the Free State, we have not delivered a single sanitary pad, if I heard correctly. And also with regards to the SABS approval, hearing that you are saying, Mr. Matshoba, that that is not compulsory for retailers. It is also extremely worrying. I think that the issue here is we've seen that, for example, if you look at the spaza shop industry, we've seen the damage that an unregulated sector can do. We've seen children dying because they are eating foods that do not comply with health standards. And then we are now saying that retailers are able to sell menstrual products that are not SABS approved. And I heard you saying that you've engaged SABS, but I think we also need to engage the Department of Trade and Industry. But I'm going to keep my questions towards the end. I'm now going to just ask that honourable members indicate to me by raising their hand, members who want to ask questions and interact with the proposal. And then, okay, I see the hands of honourable members. I see the hand of Honourable Adams, Honourable Shibango, Honourable Spies, Honourable Peterson, Honourable Chauke Adonis, Honourable Kanyile, Honourable Dr. Leklape, and I see Mam Kaula Kapisa, your hand is up. In that order, we will take the questions. Members, you are also allowed to ask questions to the petitioner. So please do, you can raise questions to both the department and the petitioner. If I've left anybody out, I think you will indicate to me, but let's just take it in that order for now.
Thank you, Chairperson. Good morning to yourself, the colleagues, the staff in the department. Thanks also for the presentation. Chairperson, my question will start under two, back to the Sanitary Dignity Program of the department. How does the department coordinate its activities with the provincial within a province? Then, how are challenges resolved that the department identifies through its monitoring of the SDP? And then, under funding for Sanitary Dignity Program, on that table that was shown to us, there is from 2019 until 2026 and 27 different allocations, especially in the Northern Cape. The total that I saw there was 17,221. Now my question, with all the allocations per financial year, do the department think, how can the a vast province will survive to cover this program? And then what informs the equitable share to provinces? Next one, what were the reasons provided by National Treasury for increasing allocations to provinces over the MTEF period, Chair? And then given the matters under beneficiaries, given the matter raised in the petition before the committee, does the department have any indication of the actual number of beneficiaries targeted and reached in provinces through NGOs? If not, why not? Does the department collaborate with NGOs in the DSP as a means of improving coordination? I'm almost done, Chair. Under advocacy and information session about menstrual health are being carried out in each quarter in provinces. Who is doing these sessions? And then, Chair, under water supply, sanitation, and hygiene assessment are being carried out in provinces to ensure that toilet facilities are conducive to menstruators' friend lines and hygienic environment. Who is conducting these assessments? My last one, Chair, on provinces that not having province sanitary dignity committees, what was the department intervention on the issue? I thank you, Chair.
Thank you very much, Honorable Adams. Honorable Shabango. Shabango.
Thank you, Honorable Chair. Greetings to yourself and the members in the platform. And let me also appreciate the presentation both by Ms. Ndwandwe and the department. And from this presentation, one would say we are the living testimony to what Ms. Ndwandwe was presenting. These menstrual frustrations, issues, embarrassment to an extent of being bullied. All this happened because we never had programs like this. And it was lack of education to our counterparts during our school years. I don't have a question, but it's just that one notes that, like you said, Honorable Chair, that the presentation that the department and the one from Ms. Ndwandwe, they are not far from each other. The interest of serving our community with this SDP it's very visible. On the presentation by the department, one can confirm that there is progress if we look at where it started up to where we are, though there is still a room for improvement on the issues that were presented, the challenges and everything. But I must say that I'm not going to waste time repeat what Ms. Honorable Adams has questioned, because my questions were around the oversight of the department in the provinces, in the regions, because we all know that the provinces are very vast, but one is looking at the province and the region, because I'm not very clear how is the oversight done by the department in all the provinces. But Ms. Adams have asked, I think, about 3 questions that I had. Let me pose the Honorable Chair. Thank you.
Thank you very much, Honorable Shabango. I see that there's a hand up of, it just says on the screen, Mabel. I don't know if the Honorable Member can just identify herself. before we go to the Honourable Speaker.
Yes, thank you very much, Honourable Speaker. It's Mabel Khwekana.
Thank you so much, Honourable Member. You are up next. You can ask your questions. Also, Honourable Members, before you continue with your questions, I see most of the questions are directed, well, I don't want to speak for the other members, but I think most of your questions are directed to the department. So I think once we are done with all our questions, we're going to ask the petitioner to make any further inputs if she wants to, and then we will excuse her so that we can continue our work with the department, because her purpose was to tell us what they want from us, and then we will continue our work, if that is okay with members. But I will continue with the questions in the order of the Honourable Member that's on the floor, and then it's Honourable Spies, followed by Honourable Peterson, followed by Honourable Kanile, followed by Honourable Chauke Adonis, followed by Dr. Leklape. Thank you, Honourable Members. Please go ahead. Ask your questions.
Thank you very much, Honourable Speaker. What I want to know, does this program reach the rural areas? If yes, can we have specifications? Because specifications are very much important. The report is general. When it talks about KwaZulu-Natal, I couldn't hear any specification where and how many schools, the names of the schools where products were distributed. Because if the report is general, it doesn't help us at all. Two, I heard that NSFAS students, they received 290 rands for cosmetics. I don't think 290 is enough for these children, especially to buy cosmetics, including sanitary towels. Kule simo somnotho esikuso la eMzansi, things are very much expensive. This will force these girls to find themselves buying sanitary towels from the spaza shops, where the quality of these sanitary towels, we know it very well. It was stated here that the sanitary towels, other sanitary towels, are not healthy for these young girls. Number three, please let the procurement processes be not complicated, because it delays the process of distribution to other provinces like Free State. Like Free State, it means Free State, they didn't receive anything at all. And does this process have a monetary system in place whereby all these works are being monitored? I submit. Thank you.
Thank you, Honourable Member. Honourable Spies.
Thank you, Honourable Chairperson. And good morning, colleagues. And also thank you for the presentation and special greetings to our petitioner. Chairperson, mine is a few observations, and then I will then ask my questions. And mine is basically because I have gone to a few schools and engaged with schools and students that are beneficiaries of this program. First of all, Chair, while our schools benefit from this current sanitary towel program, there's a number of concerns that I believe needs our attention to ensure effectiveness. And some of the key issues I will quickly highlight to members and the department as well as our guests. And I think maybe our guest petitioner, Ms. Ndwandwe, can maybe also come in here. What we found it is there's insufficient engagement with the Department of Basic Education. It's there, but it's not intensified enough. And I say that based on the following, that sanitary towels are actually stored with secretaries at schools. And at many points, it causes an embarrassment for girls to request them. Then also, I think the issue was touched on broadly, the fact that many of the products are cheap, it's inefficient, and it's uncomfortable. Also, what is found is that the program focuses only on providing pads and not neglecting essential aspects of menstrual health. And I think I've actually mentioned that before. And I think, Chair, going forward, and that's my constructive contribution, we should have a comprehensive approach, and it should maybe include the following. There should be proper menstrual health, hygiene education. And the program of Ms. Ndwande and many other NPOs working on this should really be solicited in this regard, because they are the people who work on the ground and they know exactly what to do, and they must be included. Then addressing physical effects, Chair. There's the issue of low iron levels, energy loss, the severe period pains. And what I find is that having a 17-year-old daughter is that I can afford to give, provide her with appropriate medication to help with the pain. But many girls don't have that. And I think in that regard, we need to involve the Department of Health on a much, more serious basis. Then obviously, it was mentioned the environmental and the health risks, but it is really very real, and we've seen that. And the other one is, Chair, there's nutritional guidance needed during period cycles. And then the last observation, and then I'll ask my 3 questions, is that maybe we should look at monthly after-school sessions with age-appropriate goals. And then when it comes to the distribution of pads, that it should, be a pack and rather than individual pads from the offices of secretaries. My questions, Chair, is, okay, and just finally, I think there should be a much more intensified collaboration between the Department of Education, Department of Health, and then also companies engaged in providing high-quality, eco-friendly sanitary pads. So my first question then is, what are the primary challenges facing the sanitary towel program in local schools? Ms. Ndwande, what do you think? What are those challenges? Then to the department, how can the Department of Basic Education be more effectively engaged to improve the program? And then how can the distribution method of sanitary towels be modified to reduce stigma? What additional resources do you think are needed to address menstrual health and hygiene? And then how can nutrition guidance be integrated into a program that I've mentioned? And then in terms of partnership, I believe that collaborating with local clinics and healthcare providers should be explored, and I would like that to be done. Can that be please explored, the benefits of collaborating with local clinics and healthcare providers? And then the last one, how will the revised program impact of school attendance and participation be, incorporated in the measurement of the program's effectiveness, and how will the feedback from beneficiaries be used to inform us as a committee on the above? I think that is where I would like to just stop. Thank you, Chairperson.
Thank you very much, Honourable Spies. Honourable Peterson, over to you.
Thank you so much, Chair. I would like to ask a question. When the department speaks of the the people, the young people that now get the sanitary dignity program, or where it is. My question would be, how does the department monitor the implementations of the program at the district level? And also one of the honorable members mentioned to be very specific. So I would then also like to know if it's possible that we get provided or furnished with which schools are identified, how many pads are being given, and how many learners are enrolled that require these, like the pads. And then also this, I would like this to include the Randwest district municipality. Thank you.
Thank you so much, Honorable Peterson. Can we now hand over to Honorable Kanile, please?
Oh, thank you very much, Chairperson. Questions to you, to colleagues, to all stakeholders that are with us today. Chairperson, firstly, I would like to take this opportunity and appreciate Ms. Ndwandwe for bringing this petition before Parliament. This petition is very important. And another thing that I want to mention, Chair, is that if we don't get this program right in the 7th Parliament, we need to know that we would have failed the learners on the ground that need especially this sanitary towels. With that being said, Chairperson, I went into the website and I read that in 2018, the finance minister at the time announced that the National Treasury will allocate funding to roll out free sanitary pads in schools. And Mr. Machaba, when he was doing his presentation, he indicated that the budget was made available in 2019. I find it to be very strange. Maybe if he can just elaborate to us that when he mentions the challenges of the program, and then he goes and mentions insufficient budget, yet at the same time, he is saying not all money is being spent. I'd like to find out what tool he is using to monitor that the budget is insufficient, whereas the same report indicates that the budget is that they don't spend all of it. And presentation also, he mentions this again, and this is the issue that we have been raising in this portfolio committee, that this department does not know who is responsible for sanitary towels in schools, whether it's the Department of Education or the Department of Social Development. I remember we have discussed this matter before, and we asked the department to ensure that they give us the list that in this is the department that is distributing sanitary towels, so that this can make our work easier when we want to go and conduct oversight. I have mentioned previously that in my constituency, I've been to about 3 to 4 schools. There are no sanitary towels that have been distributed in all the schools that I've been to. And I also don't even know who to hold accountable, because it is unclear who is responsible for this service. Can we then get a list, Chairperson? Maybe if we can attach a time frame to this, indicating that in this province, this is the department that is responsible, because we have also been receiving reports that in other schools that are receiving sanitary towels, the quality of the sanitary towels is inferior. And Ms. Ndwandwe, when she was doing the presentation, she elaborated details. Ms. Ndwandwe, during her presentation, she went into details and explained to all of us what are the effects of using sanitary towels that are substandard, number one. Number two, we also know even if you use sanitary towels that are scented, what is going to be the result at the end of the day. But this makes it very difficult for us to come here and confirm that the department is ensuring that sanitary towels are distributed. I have never seen sanitary towels in Mpumalanga, number one. Number two, Chairperson, the issue of Free State is very important. We need to make sure that we look into it. During the presentation, they brought it before us that the procurement takes too long. And I think it is the very same province where they indicated that not even a single sanitary towel was distributed. What I'd like to find out from the department is that what has been done or proposed by the department to ensure that this matter is resolved. And in the presentation, I also picked up that they have mentioned that in some of their challenges in the Northern Cape, it is the fact that the sanitary towels are expensive. If the sanitary towels are expensive in the Northern Cape, is the department unable to get sanitary towels elsewhere and distribute in the Northern Cape? Maybe getting the sanitary towels from Lindiwe Pets manufacturer that was mentioned before us and ensure that they are taken to Northern Cape. I just want to check, how can we try and find a solution to these challenges? I'd also like to applaud the beautiful presentation by the department chairperson, where they've indicated that in Gauteng, together with the sanitary towels, they are distributing deodorants and toothpaste. This is commendable. But what is the department doing to ensure that this is also done in the rural areas? Because I do believe that this is important and it needs to be shared equally. Chairperson, the presenter here, Mr. Machaba, also mentioned that in schools they make sure that they wash facilities, they're girl-friendly, and there's water and there's mirrors. I want to indicate that this looks beautiful on paper, but it is not the situation on the ground. We all know that we still have schools that are using pit latrines. What I'd like to know from the department is, what are they doing to ensure that children that are at the schools that are still using pit latrines, they are well taken care of, they have water, they have mirrors, and that was mentioned in the presentation. Chairperson, I think I will pause there for now. Thank you very much.
Thank you very much, Honorable Kanyile. Can we now ask our whip, Honorable Chauke Adonis, to take the floor? Honorable Adonis, it's your opportunity.
Thank you, sir. Thank you very much, Chairperson. I would like to start off by greeting honorable members, representatives of the department, representatives of the team Sanitary Pads, and the entire delegation. Chairperson, one would like to appreciate both the presentations that have been made by Team Sanitary Pads and also the department. And I think I've been largely covered by my colleagues as well in terms of some of the issues that one would want to perhaps get clarity on and also address and provide recommendations. One would also want to find out in terms of the collaboration between Team Sanitary Pads, the department, and Stats SA in acquiring the statistics of the distribution of the sanitary pads, its impact, and also knowing how many women and girls are utilizing menstrual hygiene products. Also, just to the Team SA, in terms of its intervention strategies, what are some of the intervention strategies that have been proposed to the different stakeholders or entities that they have collaborated with, such as the department and other international stakeholders, in terms of drawing up a framework to ensure that we have programs that are going to be successfully implemented, but also have a sustainability plan? Perhaps what we then need to do is look at how can we ensure that we've got a concrete monitoring and evaluation tool in place, and then ensure that we are able to successfully implement the programs for menstrual hygiene practices. Chairperson, another one would also like to raise, and I think it has also been raised by one of the colleagues, is and also Team Sanitary Pads, is the importance of ensuring that we're not just speaking about sanitary pads, but we're speaking about the whole cycle of menstrual hygiene and menstrual hygiene education. And I think when I was in high school, we used to have, I think once or quarterly, I'm not sure, a month, where we would have the different entities that would then come to the school, and we would have a girls' evening where we would then be taken through the processes of menstrual hygiene and best practices but also on feminine based practices. And I think that needs to be reintroduced. And this would then speak to the collaboration with the Department of Basic Education and going back to the LO program and making it something whereby it's compulsory and it is, how do I say, it is integrated into the curriculum. Second to that, it would be how do we ensure that there is adequate monitoring and oversight that then takes place, and ensuring that the department has the ability to execute its oversight mandate. And I think it's very important for us to really understand where the mandate of the distribution of the sanitary pads lies, which has been presented by the department to say that in some provinces it is given to the Department of Basic Education. In some provinces it's given to social development. Now, I think there needs to be a framework or a monitoring tool in place in order for us to really monitor whether the provinces are successfully implementing the program and where are some of the shortfalls, so that we're able to mitigate them before we come to an end of the year and we're finding these type of challenges that have escalated and have built on. I think also in terms of the policies, and Team Sanitary Pads did indicate that it needs to be legislated. I think what we need to review as part of our recommendations, Chairperson, and with the department as well and the relevant stakeholders as well, and civil society, is how do we reinforce the already existing policies? One would not necessarily want to reinvent the wheel, but more of reinforcing what is already existing so that we're able to really see its successful implementation. But also, I think then the responsibility will also lie on the DPME as a department as well, in terms of playing an oversight role and providing the necessary support to the Department of Women, Youth and Persons with Disabilities, and working with all the stakeholders who look to or who seek to implement this program. And I think also Team Sanitary Pads needs to also conduct its own oversight, and perhaps what they can also speak to is that do they have a plan on how they will then conduct an oversight in collaboration with the Department of Women, Youth and Persons with Disabilities and ourselves as a portfolio committee, where we will also be playing an oversight role for the departments and the entities that are responsible for distribution of the sanitary pads or sanitary menstrual hygiene products holistically, and also evaluating whether the budgets are adequate and are they being utilized. And if the budgets are not being utilized, why are they not being utilized when we do know that there is a high level of deficiency and scarcity of sanitary pads to be distributed? Lastly, Chairperson, in the first presentation, it spoke about the quality of sanitary pads. And this is something that really needs to be prioritized also by the Department of Women and Department of Health as well, in ensuring that we are distributing quality products to women and girls. And it must be prioritized in as much as we have prioritized condoms. It cannot be that condoms are prioritized over menstrual hygiene products. So I think for myself as a member of this portfolio committee, I am in support of the work that is being done by Team Sanitary Pads, and we look to hearing from them and seeing what other intervention strategies that they're able to bring to the table in collaboration with the Department of Women, Youth and Persons with Disabilities. Lastly, Chairperson, to the department, it would be what type of support would they then need from us? Once again, I repeat this from the portfolio committee, in order for us to ensure, capacitate them in their oversight responsibility, where we're having provinces who are under-delivering or underperforming. What are the consequence management strategies that we have been put in place? What then happens to those provinces? What then happens to those departments that are not executing the mandate and the recommendations that are coming from the Department of Women, Youth and Persons with Disabilities? But I also think we need to find a way of reinforcing the recommendations that are coming out of the department, because we cannot have one province that takes the mandate and the recommendations coming from the department and another province not doing so. It needs to cut across board in the entire country and in all 9 provinces in order for us to actually see an impact. Chairperson, I'm going to leave it there for now. I will come in once again. Thank you so much.
Thank you very much to the whip of the committee. Doc Leklape, you are the last speaker for now.
Thank you, Chair. I just have a few questions. One is, in terms of the initial funding of 400 being given 150, was 400 a real number? And if so, this is gross underfunding, and everything else becomes superfluous, because then part of the committee's duty is to ensure that proper funds are solicited. This issue of having underfunded mandates compromises provision. The second issue related to that is maybe this committee should consider advocating for part of the health taxes to be apportioned to service this need. I mean, there's various taxes that have been collected, sugar tax, etc., and the monies are just lying there, and they are being used for non-health purposes. And I just want to repeat the question of how do we measure success at a cold face? And there has to be an agreed way of implementing this. It can't be every province does as it pleases. And what this illustrates is that the challenge of provincialization. This needs to be a national program with accountability. The service points will be in the regions, they'll be in the provinces, but there has to be a common accountability point so that the Auditor General can come and audit the program and we get to know where the money is being placed. Lastly, because this is a health product, and I hear people talking about South African Bureau of Standards, could there be any consideration of having the South African Health Products Regulatory Authority, SAPRA, get involved so that you have the issue of standards and licensing and credentialing of manufacturers to be done as this is a health product, because that might help in terms of quality of products and things that get out there. That's all for now, Chair. Thank you.
Thank you very much, honourable members. I think all your inputs have been really valuable. I think what we are going to do now, I'm going to hand over to Team Free Sanitary Pads and then ask you just to respond to some of the questions or inputs that members have made. Then we will excuse you and then we will continue with the work that we have to do with the department. But Ms. Ndwandwe, I think firstly what I hear from members are firstly that they value the work that you do, that we support your petition, we support your proposal or the argument that we have not done enough yet in terms of making sure that we end period poverty. Looking at your presentation, for example, you make an argument to say, let's expand the VAT exemption not only on pads, but on all menstrual products. And I think it's something that this committee can look at. You also spoke, for example, about the need for maybe a tax incentive for companies who do have sanitary dignity programs. And again, this is something that we can consider and look at. But your next argument that you make is that we need legislation, new legislation. The first problem is that another bill will not solve the immediate problems that we've got, in that, as the Honourable Whip of this committee had said, there is a framework and a policy in place. It is about making sure that this framework is successful and that it speaks to the needs of all children who are in need of sanitary dignity, or females, or any person that is in need of sanitary dignity products. So for us as a committee, I think really it is to look at where are the gaps, how do we address the gaps, how do we assist the department in terms of it being able to fulfill its role. And I think, honourable members, I do not think I'm not sure whether the committee will support me in this proposal, but I think at some stage we as a committee should have a committee inquiry on the sanitary dignity framework and program so that we can understand what are the roles and responsibilities of all the MECs, the various departments. whether they are spending their money correctly, whether we are reaching all the learners that need sanitary products. Honorable Kanile spoke about the fact that in her home province, nobody or schools that she's visited are not getting sanitary products. In KwaZulu-Natal, for example, there continues to be allegations that some schools are selling these pads. So corruption is still an issue. So I think through a committee inquiry, we could possibly get deeper into the challenges and how to address them. And maybe that will be a first step towards us making sure that we intend or that we assist the department in delivering on this mandate that it's got. But Ms. Ndwendwe, I'm going to give over to you to make some closing remarks or just to make some comments in reference to some of the issues that have been raised with you. I will then excuse you, and then I will go back to the department so that we can continue our work with them. Kapisa, I think, sorry, Ms. Ndwendwe. Kapisa, I think I saw you just putting your camera on there. Did you still want to ask some questions, Kapisa? Okay, I think Honorable Kahula will then come just as we round up with the department. Over to you again. Team Free Sanitary Pads.
Thank you so much, Honorable Lizo. I just wish to comment around policy and legislation. So I think maybe I forgot to mention that by profession, I am an accountant and an aspiring chartered accountant. And so I work around policy and legislation a lot. And I think something that I've picked up from the committee is that, first of all, I'm heartbroken by the fact that Mr. Spio Machoba mentioned that the reason why they're not considering a legislation is because of litigation and that they do not have funds. However, we fought as civil society in collaboration with members of parliament and government departments to ensure that the South African government sets aside national government expenditure, which means that it can be done. It is possible. If we work together, we can push forward for a concrete way or a structured way of ensuring that menstrual products become a necessary and a basic essential, and that there's effective implementation of the menstrual product program across all schools, but across all public spaces and the workplace as well, which I think we also seem to be overlooking, that, you know, the workplace is also concerned. You know, there are menstrual health related illnesses, chronic illnesses that keep women and young girls away from accessing career opportunities and quality education. So my response would be that I wouldn't overlook the protection of human rights, the protection of the human rights of young girls and women by just merely saying that, well, the fear is that the South African government fears that NGOs like myself or other NGOs could bring forward litigation, and this is something that you cannot afford. Well, the reality is that we also cannot afford to take the government to courts, which is why we're fighting through the necessary processes, which is coming through to Parliament and ensuring that the committee understands that we have a crisis on our hands, we have a crisis at grassroots level, and that the government cannot always depend on us as NGOs. We also have full-time jobs. I do not get paid to do community work. I do community work because it's a passion, but also because of having experienced my own lived stigmas in my own life, which I feel that, you know, if I cannot function because I have severe period pains, and I cannot go to work because I have severe period pains, and there's no policy or legislation that protects me or protects my rights. Imagine the rights of young girls and women in rural communities or in schools who actually suffer from severe menstrual health related chronic illnesses and who cannot access quality education and who do not have any form of protection to say, well, you cannot come to school for a certain period until you recover from that severe period pain or you recover from the menstrual health related illnesses. I could lose out on my job because there's no protection around the fact that, well, I have a menstrual health chronic illness, I have to take certain time off work, but also there's also that the possibility of the fact that I could suffer from another novel illness, which could eat up all my sick leave days. So there's also that argument around that, the fact that we cannot overlook the protection of human rights merely because the South African government fears litigation. We are not here to fight the South African government. We are here to fight for the human rights of young girls and all women. I believe that we need a legislation, a structured legislation that actually states accountability, that states the fact that the responsibilities of various departments and that there's clarity going forward as to how to address the various issues that Mr. Machoba brought forward, the fact that there's delays in procurement. If there's no structured legislation, I mean, you could accelerate the existing frameworks, but let the frameworks have teeth. Let the frameworks have legislation so that we can hold various individuals accountable. It's not just the government that can be held accountable, it's civil society as well. It's the spaza shops that are selling poor quality menstrual products that could be of very detriment to the young girls and women, particularly the women's health. So I feel like perhaps the portfolio committee could actually reconsider the fact that we need a legislation in the country. Thank you.
Thank you very much, Ms. Ndwandwe. As I said before, we really value the work that you are doing in protecting the rights of young girls. We do take your petition very seriously, and please be assured of this committee's support. We will be prioritizing the Sanitary Dignity program and framework, and it's something that we're going to be taking very seriously to identify the gaps, to look at all the proposals that you have made, and we will definitely be taking you along on this journey as we work to make sure that it's a success going forward. Honourable members, I'm now going to give, I know also I wanted to check, I heard members have to take the bus by 12. I'm sorry that we're talking about buses when we're still here with colleagues. Ms. Ndwandwe, you are free to leave us now. We will continue with the work. We still have to ask the department to answer our questions. Members, I have said before, I think we do require a committee inquiry into all of the issues that both Ms. Ndwandwe has raised, but also the issues that the department is raising. I think there are far too many gaps. For example, I get a picture that we do not understand, we do not have a full appreciation for how many learners are in need of sanitary dignity products and how many are receiving them. I'm concerned about the issue of service providers, whether the service providers are fit for purpose. Are they delivering quality products? I'm worried about corruption and whether we have been able to root out corruption in the whole value chain. So there's a lot of issues that would require us as a committee to intervene so that we call all the stakeholders together. We call the MECs, we call the departments, and that we look deeper into the challenges and concerns as Ms. Ndwandwe has raised, but also the concerns that all of you have articulated in your inputs. I'm going to hand over to the department to just summarize. I've got a couple of questions as well, but I know you've got a lot of questions to answer. I wanted to ask you, Mr. Machoba, what is the monitoring and evaluation tool look like for the Sanitary Dignity program? Whether you can share that with the committee or just elaborate on how you do that. But I think you've got a lot of questions to answer, and I know members are pressed for time. So I'm sorry that we took a little bit long. Back over to you, Mr. Machoba, to give us the answers to the questions that honourable members have asked. If you're not able to answer all the questions, as we always do in this committee, I will ask that some questions are then furnished to the committee in writing within the next 48 hours. But I hand over to you to answer those questions of the members. Thank you.
Thank you very much, Chairperson and honorable members. I think I can answer most of the questions, and then if there are time constraints, then others can always follow up in writing. But let me try to
Machoba, sorry, I'm sorry about that. I see Mam Kahula is on the platform again, and maybe she would just like to ask her questions quickly, and if you're not able to answer her questions now, that it's put in writing, but I don't want to skip her if she wants to ask. Kapisa? Kapisa, you're muted if you want to ask questions. No, it looks like she's not ready to ask questions. I'm sorry about that. Please do proceed.
Thank you very much, Chairperson. If I can begin, firstly, just to support your commentary at the end to say that perhaps there needs to be an engagement that also involves premiers, MECs, heads of department of these two departments, being education and social development, so that they can actually really give the committee blow-by-blow information around what we refer to as the elephant in the room, procurement. Because our belief is that other issues that have been raised by honorable members, which are very, very important, however, there are issues that we can work on, but as long as that elephant in the room of provinces having a budget and not using it, or not using it optimally, that becomes a problem. So we fully support that, ma'am. Firstly, to respond to the Honorable Adonis, in terms of how we coordinate with provinces, which speaks to the M&E issue that we're talking about, Chairperson, is that first and foremost, we have quarterly meetings with provinces wherein they give us reports in as far as their reach to beneficiaries and where there has not been a reach, what the problems are and how they intend to solve those problems. And then we would troubleshoot, go to provinces, and also there would be DG correspondences with her counterparts. And then at district and local level, there is also besides a provincial sanitary dignity committee that is under the auspices of the provinces. There are also district and local committees. And at school level, there's what is called the school-based support team, wherein it is composed of SGB members, teachers, and in particular LO teachers, and various important constituencies within the school setting. So at an institutional level, there are structures for accountability, but the challenges obviously are sometimes the dysfunctionality of those structures in certain provinces or in certain districts. That is why then we have actually developed a monitoring and evaluation framework, which we are now workshopping the provinces on that M&E framework so that they can improve on the element of planning, execution, and monitoring. But also what we have realized, Chairperson, is that provinces aren't the same. There are provinces that are doing well. The Western Cape is doing very well with the program. KZN is doing well. And we wouldn't want those to be tarred with the same brush as your Free States of this world. So in other words, there would be situations where some provinces really have a lot of innovations. There's a lot of thinking around early planning, because the most important thing is that for successful execution, planning is very, 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 very critical. A typical example in the Eastern Cape, one of the problems around the chronic procurement process challenge is that, contrary to what we had informed them, that there should be a 3-year cycle in terms of the procurement, in terms of the contract for service providers, so that you don't have to conduct an annual procurement process, because they procure every year, and as a result it's back-to-back procurement, and it's unworkable. It just can't work in the theater of reality. So those are the issues that we are trying to point out to provinces. In terms of the Northern Cape allocation, with the Northern Cape, initially the allocation was 10 million at the inception of the program. But because at the beginning, the province did not utilize its budget, and then it was cut by National Treasury. But we're hoping that now, because they are back in full operation, perhaps the budget could be increased to actually mitigate whatever gaps that are there. And in terms of the equitable share allocation, as I had indicated, Chairperson and honorable members, that is really, as we had indicated, it's not equal but equitable in the sense that it is determined by the population density. But of course, the unique problem or challenge of the Northern Cape is that as much as it has less in terms of scholar population density, but the province is a huge geographic space. And as a result, that tends to obviously hamper on the distribution process, on the human resource availability within the Department of Education. Hence, we had asked them to actually collaborate with other departments because there's usually a distribution of stationery, nutrition, and all other consignments to school. The Sanitary Dignity Program is not the sole program. So we have said they must look at how to collaborate within existing a basket of services that are accorded to communities. We are working on that. And also we've asked for that collaboration, Honorable Adams, that you have referred to, working with NGOs to ensure that NGOs are the eyes and ears. They're able to indicate that in District A, School A, there's been no delivery, so that issue can be escalated back to the Department of Education or to us as the Department of Women. In terms of the WASH assessments, we conduct these WASH assessments on a quarterly basis in the schools to look at what mitigation plans are there. But what we have in collaboration with the Department of Basic Education is that perhaps we need to share that information with honorable members. We do have a summary of the sanitation gaps throughout the country, province per province, which indicates where the gaps are and what is currently happening. Because within the Department of Basic Education, there's what is called a sanitation integrated education program.
Sengikhona-ke.
Kapisa.
Hayi sengikhona mfethu. Ngeke ningivalele ngaphandle.
Kapisa, please mute. We will come back to you in a minute.
Okay.
Thank you, Chairperson. As I was saying, when I conclude on responding to Honorable Adams, is that perhaps we need to have that information provided, which indicates the gaps that are there. And there is already a program called the SAFE Initiative, Sanitation Appropriate for Education, where pit latrines are being eliminated, where newly ones are constructed, which are up to the current specifications of what a decent toilet in a school environment should be. But I must confess that the process is slow, and we would wish that it would have been much faster. And also to Honorable Shabangu, yes, indeed, Honorable Member, it's important to note that there is room for improvement, and that is something that we aim to do. It's our quest every time we see these gaps. That is why we are trying to improve on monitoring. And to the Honorable Kwetlane, KZN, Honorable Kwetlane, as I've indicated, that is one of the provinces that is able to reach all its beneficiaries. And that is something that is commendable from that province. However, there would be some missteps. Hence, perhaps it would be important if the schools that may not have been reached for one reason or the other, we have information around that, so that we can then have a bilateral with KZN Department of Education, so that we can actually be able to address those issues. And then on the 290 monthly stipend, what really government was trying to do here through the NFSAS was to not necessarily give a student a grocery kind of budgetary allocation, but something minimal, at least to the extent that at least a student can be able to purchase a menstrual product or a toothpaste or soap. However, if the view is that this amount is too little, that is something that we can obviously have a bilateral with the Department of Higher Education and Training, as well as NFSAS about, and see. Perhaps they've also conducted their own evaluation. So we may actually find that they are already perhaps of the same mind as yours, Honorable Member. We'll follow up the issue as to whether that 290 is appropriate. Because unfortunately, when it was issued, we are not sure what were the calculations to the extent that 290 would be adequate. So we're also in the dark about that. We're just pleased that there is an allocation. However, we will follow up. In as far as the Free State issue, well, of course, the Eastern Cape is, the Free State is the worst example of indicating how procurement affects non-delivery and how that non-delivery affects learners. Because we have always said to provinces when we try to appeal to them that whilst you delay procurement processes, and unfortunately, those poor learners cannot delay menstruation. So this is a human rights abuse, and we are asking that these issues must be corrected. But as I'm saying, there's a fundamental issue. We need to really, really awaken to that. Procurement in provinces is a problem, and we must not minimize that issue. It's a huge problem. And then to Honorable Spies, she's indicated correctly that it would have been ideal if we had a budget that is commensurate with a full package of all-round menstrual products for menstruators, which also not just speaks to menstrual products per se, but also addressing period or menstrual pain. We have had a discussion through the Integrated School Health Program with the Department of Health, Education and Social Development. There are mobile clinics, honorable members, that frequent the schools, but I must say that what we have to monitor more closely is exactly the word frequency. How frequent is frequent? So that's the issue that we need to follow up. But we do know that there are mobile clinics. But of course, there's an issue where, especially when it comes to contraceptives, learners have given us feedback to say that they are stigmatized when they go to clinics instead of being assisted. Nurses, not all of them, of course. Some nurses are mean to them. They ask them, why are they even on contraceptive? Why are they dating at that particular age? So there's a lot of unnecessary stigmatization and other people's own moral opinions about these issues. So there's a whole lot of issues that need to be done, Honorable Spies. Then in schools, there is the age-appropriate comprehensive sexuality education program through the life orientation class, where they teach menstrual health, sexual and reproductive health rights issues, bullying, gender-based violence, through the Department of Basic Education. But I must say here also, there is a challenge in that not all LO teachers, not all life orientation teachers of necessity are knowledgeable about teaching these issues, because some of them are just allocated the subject. They are not necessarily trained LO teachers. So you find that in our pilot in Utugela and Alfred Nzo, some LO teachers are remarkable. They are very good, very effective. Some are not, because not all of them are necessarily up to specification, which speaks to training of LO teachers by the Department of Basic Education so that they can be up to specifications when they teach the subject. And then also the issue of intensification of collaboration, that we agree with that, ma'am, is something that we have to do. And also to Honorable Peterson, she spoke about monitoring the program and getting the statistics and working together with Ms. Nwandwe's organization and other organizations. We shall do that, ma'am, is something that is quite very, very important. And then the Honorable Kanyile from Mpumalanga, I think it's very important that she raised the issue about money not being spent. The issue is that we already know from provinces that spend all their money that to some it does not cover all their beneficiaries. So it's easy then to actually look at and recognize those particular gaps. A typical example in Mpumalanga, just an illustration of what we are talking about the inadequacy of the budget. Mpumalanga cannot, Honorable Kanyile and honorable members, go beyond quintals 1 because of the high numbers vis-a-vis the budget that they receive. So only at this stage, quintals 1 receive these sanitary pads. Quintal 2 and 3, unfortunately, they do not. So that demonstrates the difficulty with the budgetary issues. Hence, then they target quintals 1 because in the scheme of things, they would be the poorest of the poor versus the other quintals. And then on the issue of the perception of inferiority of some of the pads, is something that we we would be very happy if we could get information around that so that we can follow it up, because the pads that are supposed to be distributed to schools are quality SABS approved pads. But it's something that we are willing, Honorable Kanyile, to follow up with you so that we can get to the bottom of this. And then in terms of the sanitary towers being expensive in the Northern Cape, I'm not aware of that, except that I had spoken about the expansiveness of the province. Hence, then, you know, clearly there are some financial constraints in terms of the admin and transportation and the logistics pertaining to taking pets from one school to the other. Yes, indeed, the Gauteng example of those basket of services beyond sanitary pads is commendable. And if the budget was available, in fact, the Gauteng model would be the best model for all provinces. But unfortunately, the reality at this stage is that there's a budgetary issue. And you've spoken about WASH and pit latrines, as I've already indicated that there is a program. In fact, in Mpumalanga, the MEC for Education has allocated 30 million, which will ensure that, as she said on national TV, that by October of 2025, in Mpumalanga, they will have eliminated pit latrines. So we have that information. And then I'm going towards the end. The Honorable Chauke Adonis, she also spoke about that collaboration with Team SA, DWIPD, and others. We accept that, ma'am. We'll do that. And then in terms of menstrual health education in the schools, I've already alluded to attention that has to be given to that age-appropriate comprehensive education program that starts from grade 3 to grade 12. And also there's a life science class for grade 11s and 12s, what was called in our time biology, because also there's an element of sexual reproductive health issues there. So that's something that needs to be sorted out. You had asked, Honorable Adonis, that what type of service can perhaps the portfolio committee render to assist us as a department. Honestly, for me, the only thing that I would want to point out is unlocking procurement processes in province. Once you unlock that, it means products go to learners in the right time, in the right quantity, and also in the right quality, so that if the budget is used every rand and cent, we can then, from an evidence-based perspective, be able to go to National Treasury to say, here are the gaps, and this is how we've costed them. This is the money that we need. But if provinces either don't use the money or use it partially, you are going to be laughed at by National Treasury because you're not coming with something that is evidence-based. And then the second last, or rather the last, yes, Dr. Letlape, he's made a very profound point to talk about an underfunded mandate. We do indeed have a financial mandate, but it is an underfunded mandate. And if some taxes could be found to augment the program, that would really be quite commendable. And indeed, Dr. Letlape and honorable members, apart from the South African Bureau of Standards, also SAPRA, the South African Health Products Regulatory Authority, is also a partner in terms of product safety. Most importantly, on menstrual cups and tampons, because those products are insertions into the human body. So there are biomedical issues, as you would imagine. And also, we have to deal also with the religious and cultural issues around insertion. For instance, in areas that practice virginity testing, whether you believe in that or not is neither here nor there. But the fact of the matter is that there is also some reluctance out there in particular communities about insertion or menstrual products that you have to insert other than your disposable sanitary pad or your reusable and rewashable. So there's a lot of education that needs to come in, but also from the point of view of manufacturers, apart from a manufacturer for these two products having an SABS standard must also have a SAPRA license because of exactly these biomedical issues that Doc has actually alluded to. So as I conclude, Honorable Chair and colleagues, the program is ongoing. The program is showing strength, but the program indeed has gaps. But these are gaps that can be mitigated. But again, if we can just unlock the fact that if we talk service delivery, it means pads must reach the learners. That is the issue that needs to be unlocked. Thank you, ma'am.
Thank you very much, Mr. Mashoba. Thank you very much for those inputs. I think I did make the point earlier about the non-arrival of the DG, and just to ask that we do ask the DG to attend when we do discuss these matters again in the next meeting. But when you spoke earlier about the fact that you've got a sanitation gaps report, and I think the committee would be very interested in receiving that. Also, just to, as I've asked before, that you share your monitoring and evaluation tool for the SDP, so that we know, or we're educated in terms of what it looks like. But honourable members, I think then, I don't know how we feel, we can discuss it in the next meeting, but I do think a committee inquiry where we look, for example, at the challenges of the service providers, the finances, the struggles of the Free State Province, Mpumalanga, looking at all the gaps in terms of this framework and program, so that we engage with MECs, we engage with social development, we engage with the Department of Education. I think it will be important, because then also we can zoom in on the issues of the South African Bureau of Standards, the issues around corruption, and all of the elements that goes around this framework to make sure that we address all the gaps. I would like to say thank you very much to the department. Members, I know our time is running out. I would just like for members to stay just for 2 minutes so that I can just discuss 2 or 3 things with you quickly before you go to catch the bus. Honourable members, unfortunately also today is a bit of a sad day. Thank you to the department. I think you are able to leave us now. We will continue with our internal business, if you don't mind.
Thank you, ma'am, and honourable members.
Thank you so much, Mr. Matsoba. Honourable members, we won't have time now to adopt the minutes. So if you do agree...
You did allow me, but it's okay.
Mom Kola, I'm very sorry. We did call you a couple of times, but next time I will give you the first opportunity. But you can also still submit those questions in writing, and we'll make sure that it's answered. Thank you. Thank you, Kapisa. Honourable members, we won't have time now to approve the minutes. So I would like to ask whether we can approve them at another meeting or a special meeting that we will have just to approve the minutes. If you're okay with that? Also, honourable members, today is a sad day for all of us, because Ms. Nobotana, this was her last meeting with us, and she will be retiring from Parliament after decades of service to Parliament. But I think we will have an opportunity to still say goodbye to her. Honourable members, I also want to say that we won't see each other next week. The parliamentary program has changed. So next week is a constituency week. The week thereafter, you will see from the program that Parliament starts at 10 o'clock in the morning with a debate on 16 days of activism, in which I think all of us will participate. So we will only see each other again in 3 weeks' time, when we meet to shortlist the candidates for the NYDA board. I also wanted to say I've extended an invitation to all members for lunch for tomorrow, and it's at 12:15 in the Marks building in the coffee shop area. Also, maybe tomorrow, if we do have a discussion just informally, I want to suggest, apart from this committee inquiry, that we also look, honourable members, at our program and which departments we feel we should urgently engage in terms of our oversight role. I know we've spoken about the Department of Education and others, but I would like to get your inputs in terms of our oversight role. Which departments do you feel is most urgent for us to call and engage on? And then finally, honorable members, I want to say thank you very much for participating in this meeting. I found all your inputs very valuable. I think this is a program that really requires our urgent attention. I think we need to delve deeper into some of these issues pertaining to the struggles, in particular, like, for example, the Free State and other provinces. I don't know if any other member wants to add anything at this stage before we close and rush to the National Assembly. Anyone? Okay, honorable members, then we will see each other tomorrow if you are available, and we will talk about our issues in terms of the program and our other issues then in terms of the program and some of the plans like the committee inquiry that we want to have. Honorable members, I wish you well. Enjoy the rest of your day. We will talk tomorrow, 12:15, lunch in the Marx building if you are available. Thank you, honorable members.
Thank you, Chair, and goodbye.
Thank you.
Thank you.
Thank you, members.
Bye.
Bye. Bye.
Bye, Kapisa.
Bye-bye, Kapisa. See you later.
Thank you. Thank you, Chair.
Thank you so much, Honorable Kanyile.